Okay, I think we'll get started. Hello, everybody. Thank you for joining us. Today, the goal of our webinar is to introduce a new resource. It's called Partnering with California's Early Care and Education Community to Prevent Childhood Obesity. And it's a guide or a guidebook for public health professionals. This webinar is being presented via Zoom. There is a chat function on the right side of your screen that you can use to ask questions. We plan to answer all the questions at the end of the presentation. And if we happen to run out of time, we'll follow up with answers in an email. So the webinar is being recorded, and we'll share the link at the end of the recording afterward for those who can't join us today. Also, all of you who are here today will receive an email tomorrow with a short online survey, and we would appreciate your feedback, so if you could take a minute to respond. So we're very happy with those who have registered today. Around 50 people signed up for our webinar, and we have a representation from all over California, from Imperial County to Del Norte, so we feel really great about reaching the whole state with this important information of how to partner with early care and education in California. So first of all, this guidebook was developed by the University of California, San Francisco School of Nursing's Child Care Health Program with support from the United States Department of Agriculture, USDA, through the California Department of Public Health. So we are out here talking to you from the UCSF School of Nursing, and this is Bobby Rose, and I'm joined today in the room by Abby Alcon and Mira Liao. We'd like to thank Monet Parham Lee at the California Department of Public Health for her leadership and support in developing this guidebook. So this guidebook invites you to join the partnership to build a healthy future for California's children and families. In the guidebook, you'll find information about early care and education, also called ECE, the landscape, the funding, laws, best practices, advocacy, and quality improvement. There are ideas for impacting policies, systems, and environments, otherwise known as PSE, that support young children's growth at a healthy weight. And there are how-to strategies to form effective partnerships across disciplines on the local level. So a little word about partnerships before we get started. We can't talk about partnerships with ECE without touching on the importance of building trusting relationships. ECE professionals have important and challenging work, and their days are full and busy when they're caring for young children. So it may take some time, but your efforts to build community and make lasting connections will really make a difference. So to start off, you may be wondering, where can I find the guidebook? So we are currently adding the finishing touches to the layout, but soon it will be posted to the CCHP website, and the link to the CCHP website is here. It will also be posted to the CDPH website. So watch for an announcement in the local health department newsletter that you get bi-weekly, and that will have a link to the PDF when it is posted. There will be a limited number of printed copies, but the guidebook is primarily intended as an electronic resource because it has lots of excellent links to online resources and other kinds of information that will be useful to you in your work. So our objectives today are for participants to become familiar with the information and resources in the guidebook, to understand how the guidebook can be used to create new partnerships and strengthen existing partnerships with ECE. And lastly, to discuss how public health professionals can impact policy systems and environments to prevent childhood obesity through partnerships.
We're just checking our screen for a minute, just a second.
Thank you.
So we're just getting back to our screen to get the slides available to you.
So hopefully you're seeing, I'm just going to back up for a second so that you can see the slides that we just passed. I apologize for that. So this is our opening slide, and here's a slide on our partnerships. This is actually what the guidebook looks like. The guidebook has a cute graphics, and this is the table of contents. Also, here's the slide with a picture of the news bulletin where you will find the link to the guidebook when it comes out. It's the same news bulletin that possibly you got the information to register for this webinar. Also, this is the homepage of CCHP, and the guidebook will also be posted here. Okay, so we're back at the objectives. So hopefully by the end of today, you'll be familiar with the information and resources that you can find in the guidebook. And then you'll understand how the guidebook can be used to create new partnerships and strengthen existing partnerships with the ECE community, and discuss how public health professionals can impact the policy systems and environments to prevent childhood obesity through these partnerships. In the guidebook, you will find examples of successful partnerships between public health and ECE, suggestions for forming partnerships at the local level. There are some great tools to get you started. There's a template for identifying potential local partners with a sample letter of introduction in the form of an email. You could also put it in a text or a written letter. There's a list of emerging opportunities for working across disciplines. And in the appendix, we have an extensive glossary of ECE terms, programs, key partners, and acronyms. So the ECE world actually has a lot of acronyms, so I anticipate that the glossary might be very useful to you. So the fields of public health and ECE are a natural fit for collaboration to prevent childhood obesity. Both disciplines recognize the potential for experiences in early childhood to affect a person's entire lifetime. ECE programs and facilities are the perfect place for place-based changes that impact children's everyday lives. In fact, if you want to make changes, really it's important to go to where the children are, and there are many, many children in ECE every day. The local childcare community has many support systems already in place, and childcare programs are a great place to connect with families with young children. Also, on the systems level, federal and state regulations and standards exist all the way down to policies that can exist on the childcare center level. So there are many opportunities to promote obesity prevention strategies. So let's talk just a little bit about childhood obesity in California. So according to the California Health Intervention Survey, over 13% of children ages 2 to 11 were overweight for age. And this is in the data from 2011 to 2014. So echoing the national data, rates of overweight for children ages 2 to 11 were higher for Latino and non-Latino African Americans than for Latino white and non-Latino Asian populations. Interestingly, rates of overweight vary greatly by location. For example, the percentage of children ages 2 to 11 who were overweight for age was over 25% in Kern County and 8%, a little over 8% in the similarly sized Sacramento County. So I don't mean to call out anybody in particular, but just to show the range right here within our state. As you know, California has a wide range of geographic, economic, and cultural attributes. So it's very important to be in touch with what's happening in your local community. So let's talk a little bit about early care and education in California. So ECE is an umbrella term. It includes many kinds of care and education for young children in a variety of different settings. Sometimes ECE is also short for early childhood education rather than early care and education. Early childhood education can include children up to age 8 or 3rd grade, but for purposes of this guidebook, we are focusing on birth to kindergarten entry for your partnerships with early care and education community. The term ECE is used frequently, but it's not used universally. In fact, some people may never have even heard it. Families will often use the term daycare, and the Child and Adult Care Food Program, or CACFP, refers to daycare homes as well. Community Care Licensing Division at the California Department of Social Services in our state uses the terms childcare, family childcare homes, and childcare centers. So as you can see on this slide, there are just lots of different words that are really describing the same kinds of places where children might be spending the day while their parents are away. So you could hear nursery school, pre-K, migrant childcare, tribal childcare, family, friend, and neighbor care. These terms all can be used to describe places where children are when they're not being cared for at home. This is a new graphic. Some of you may have already seen it. It's from the Centers for Disease Control, and it shows how different aspects of the ECE infrastructure can work together with the shared goal of improving policies, practices, and environments around childhood obesity prevention activities. And as you can see here, they have called out nutrition, breastfeeding, physical activity, and screen time as areas that are sort of ripe for different kinds of interventions. Different organizations, agencies, communities, programs such as funding, professional development and recognition, technical assistance, early learning standards, licensing regulations, and quality rating and improvement systems are all places where changes and impactful interventions can take place. So these are all recognized as avenues for childhood obesity prevention strategies. And this graphic is in the guidebook in the appendix section if you want to look at it more carefully. So as far as ECE in California goes, we were very specific in the guidebook to make sure we address, in fact, California's landscape. So the guidebook provides information and background specifically on the landscape of California, including the workforce, the kinds of childcare, the availability of childcare, looking for and finding childcare, and cost and affordability, all important issues in the landscape. So let's talk a minute about licensed childcare in California. So there are over 40,000 licensed childcare facilities in California with a capacity for nearly 1 million young children ages birth to kindergarten entry. The Department of Social Services, Community Care Licensing, is responsible for regulating and monitoring licensed childcare programs. Licensed childcare can be center-based, or it can be in the home of the provider known as family childcare homes. The guidebook provides additional information for you on licensed childcare in California. Some child care arrangements are not regulated or licensed, and by California law are exempt from licensing regulations. Sometimes called family, friend, and neighbor care, license-exempt care for a child or children from the same family may be provided by a relative or non-relative. It can be in the child's home or in the home of a child care provider. Care provided by relatives is more common than non-relative care, especially for infants and toddlers. And grandmothers are the most common relative to provide care. Families with low incomes are more likely to rely on license-exempt child care arrangements. Tribally regulated ECE programs or tribal childcare, both on and off tribal lands, serve tribal families, children, and communities, and provide culturally relevant childcare. As part of sovereign nations, tribal childcare programs are exempt from licensing regulations in California. So you might ask, how do families with young children go about finding childcare? The guidebook discusses various systems that are already in place in California to help families find childcare while they work, look for work, go to school, or improve their job prospects. Most families, so who pays for ECE? Most families in California pay tuition or fees for childcare costs, and these costs are typically a large part of a family's budget. Even though there are childcare tax credits available, childcare costs can exceed costs for housing expenses. And yet, most childcare programs run on tight budgets to stay affordable, while early care educators often earn less than those of other professions with similar work demands. So it creates sort of a financial crunch for a lot of people on both ends. So this is why in the guidebook, we discuss the public funding. So there are various state and federal funding streams that support child care services. Publicly funded ECE services for children from low-income families in California draw from a mix of both state and federal funds. The California Department of Education, or CDE, is the lead agency for the Federal Child Care and Development Block Grant. And the federal USDA funding for Child and Adult Care Food Program is administered through the CDE Nutrition Services Division. There are also federal funds that come from the Federal Office of Head Start, the Office of Head Start, and those funds go directly to Head Start grantees. This information is a little hard to process, and for most people it takes a little time to understand it, so give yourself a minute to kind of process some of these terms and to get a feeling for where the public funding comes from. There's also the Alternative Payment Program. You may have heard of it. Alternative Payment, or AP, sometimes known as vouchers, pays for child care expenses through CalWORKS, also the Department of Social Services. Individuals who provide license-exempt child care services and licensed child care centers and licensed child care family homes can all receive AP for child care services. To be eligible, families must meet the criteria and be working, looking for work, participating in job training, homeless, or incapacitated. So take a look at the guidebook for more detailed information on public funding for ECE. As was mentioned earlier, federal funds are provided directly to fund local Head Start programs. So just a word about Head Start. Head Start provides high-quality early learning programs coupled with health, nutrition, and family services for children ages birth to 5 years and their families. Family eligibility is based on the federal poverty guidelines, and in California, that seems very low. California has the largest number of Head Start grantees in the nation, with 191 grantees and 88 delegate agencies, and a total enrollment of over 100,000 children and pregnant women. Many Head Start grantees and delegates have contracts with CDE as well, and in this case, they're able to layer state and federal funding and offer full-day, year-round early learning programs that benefit young children and their families. The USDA Child and Adult Care Food Program, you probably have heard of, or CACFP, provides public funding to a variety of public and private nonprofit child care centers, infant centers, Head Start programs, family child care homes, preschools, emergency shelters, and after-school programs. For-profit licensed centers may also be eligible to participate if 25% or more of their participating children qualify as low income. CACFP is administered through the CDE Nutrition Services Department, and monitoring and reimbursement are handled differently depending on if the program is a center or a family child care home. For example, child care centers are reimbursed directly for meals and snacks, and family child care homes have a sponsor, and the sponsor monitors compliance, provides resources, professional development, and technical assistance with reimbursement. You can find out more about CACFP with links to different aspects of the program in the guidebook. So meeting the need. Despite the variety of publicly funded ECE programs, only 33% of qualifying children ages birth to 5 years get subsidized ECE in California. So it's sort of a sobering fact. All right, so let's move on to laws and regulations about nutrition and physical activity in ECE. So the existing systems for policy on nutrition and physical activity for young children and child care programs can seem very complicated. The guidebook provides information to help you navigate the laws and systems that are already in place. Examples of state laws are found in the child care licensing regulations, also known as Title 22, and also Title V for state-funded child care programs. Examples of federal laws are the Head Start performance standards and the CACFP meal patterns. I'm just going to go through the state level laws to pull out a few so that you can get an example, some idea of what's already there. So there are already several state level laws in place to support healthy nutrition and physical activity for young children in child care programs. Licensed child care centers, not family child care homes, that are serving meals and snacks must follow the CACFP meal patterns. So that is in our licensing regulations in California. Each infant in a licensed infant care center must have an individual feeding plan, and arrangements for privacy to breastfeed must be made upon request of the mother. So a few things already in place. Here are some more things that are in place. There's a healthy beverages in child care law, and that's found in the California Health and Safety Code. And it has 4 main messages, and those are that no sweetened beverages, natural or artificial, can be served in licensed child care homes or centers, so that this law actually applies to both. Milk served to children 2 years of age and older must be low fat, 1%, or skim, and also be unsweetened. No more than 1 serving of 100% fruit juice can be served per day, and that should be a child-sized serving. and drinking water must be available and accessible. So again, these laws are already in place for our licensed childcare programs in California. Now, that doesn't mean that everybody knows about these laws, but they definitely are in place. Title V is for state-funded childcare programs, and there are a couple of regulations on the books for that. So Title V programs are required to serve nutritious meals and snacks. They're required to provide sufficient time, indoor and outdoor space, equipment, materials, and guidelines for active play and movement. And the meals and snacks must be culturally and developmentally appropriate to meet the nutritional requirements specified by CACFP. So there is also a one-time 8-hour training on preventive health required to become a licensed child care provider in California. This class must include 1 hour of nutrition education. So this is a relatively new requirement. The content must be approved by the Emergency Medical Services Authority, otherwise known as EMSA, and must be consistent with the USDA dietary guidelines for Americans. The class must include information on CACFP, including how child care providers can participate. So as you can see, we do already have a number of laws that support healthy nutrition and physical activity for children in childcare, but that doesn't mean that there's not room for more and some technical assistance around the laws. So on the federal level, these are also described in the guidebook. We won't go into a lot of detail on the federal laws at this point, but examples of federal level laws and standards are Head Start Program Performance Standards, the USDA Child and Adult Care Food Program Meal Patterns, and Americans with Disabilities. The ADA provides some information on public accommodation for children who might have special needs around physical activity and nutrition. So you'll find direct links to additional information in the guidebook. So a little bit about best practices. So best practices combine the results of significant published research findings with expert and professional opinions from experts in the field. Best practice recommendations listed in the guidebook identify effective strategies for working with children, families, and child care providers on improving nutrition and physical activity. The guidebook will list best practices both on the national level and state level. We have both in California. So best practices that are mentioned in the guidebook are from Caring for Our Children, from the Institute of Medicine, from the CDC, from Healthy Kids, Healthy Future, from CACFP, and physical activity guidelines from Shape America and NASPE, which is the National Association for Sports and Physical Education. Best practices on the state level are specific to California. And the California Department of Education's Early Learning and Care Division is a source of many of these best practices, including the California Early Childhood Educator Competencies, the California Preschool Learning Foundation's Desired Results for Children and Families, otherwise known as the DRDP, and others listed in the guidebook. That looks like kind of a delicious snack. So what are other states doing? So we looked at other states to get ideas for obesity prevention and ECE to maybe inform some of the things we could do in California. The guidebook describes how North Carolina, New York, and Delaware have included ECE settings in their statewide efforts to reduce obesity. You will find many examples of efforts that build systems, policy, and environmental changes, like California or North Carolina's ECE licensing regulations, which contain requirements for nutrition, physical activity, and screen time. Some of the results are achieved because of really strong partnerships in these states. For example, in Delaware, a partnership between their Department of Education and the United Way put together some funding to implement some of the first efforts around their quality rating and improvement system. You can also address obesity in the ECE setting by promoting and advocating for policies that encourage healthy nutrition and physical activity. The guidebook gives examples of policies and opportunities for advocacy over a range of levels. For example, starting with the home and family, things around healthy celebrations and family meals, moving on to license-exempt care and ideas for culturally relevant nutrition and physical activity, including licensed childcare, state laws, and licensing regulations, and moving up to federal laws for things such as safe drinking water or safe routes to school. You can also think globally with international organizations that address global topics such as breastfeeding, the food supply, and the environment. So that can be found in the guidebook as well. Another section of the guidebook is devoted to examples of successful partnerships that have been forged between public health and ECE right here in California. And we know that there have been many efforts across the state, and sadly we couldn't write on all of them, so we picked out 3 to highlight, and those are Healthy Apple in San Francisco, supporting breastfeeding families from Alameda County, and the San Diego County Childhood Obesity Initiative. So we describe each of these partnerships, and that may provide some information for you as you may move forward in forming partnerships on the local level. In the guidebook, you will also find a roadmap. This roadmap has lots of twists and turns, as you can see, because there's no straight line to partnerships. But you will find lots of information to help you pave the way in the roadbook section, roadmap section of the guidebook. In addition, the guidebook's partnership template will help you get started to forming partnerships. It supplies links to local organizations that have ties to ECE. And this is an open field template that you can fill out with information that's really very specific to your local region and help you make contacts. So the template can be used to find and keep track of all the contact information that you might need to find potential partners in your local area. Another tool that is provided is the sample email for reaching out to the ECE community. This is sort of what it looks like, and you would be able to copy paste it right into an email should you like, and change your name, of course, and fill in the blanks. But hopefully this will sort of help you maybe with the first step in reaching out. At the end of the guidebook, you will find a list of emerging opportunities for partnerships with ECE. So opportunities exist both on state and local levels. I think a lot of you will be working mostly on local activities, but for those of you who want to get involved in state level activities, there are opportunities there as well. So an example of a state level opportunity that a public health professional could take part in would be to provide data and information to inform the development of possibly new licensing regulations. And then an example on the local level would be just working locally to increase enrollment for childcare providers to participate in CACFP. There are a lot of childcare providers who don't even know about CACFP. They don't know that they could be reimbursed, that they could actually receive money to help them afford to buy food, and that there's are just great materials, ideas for menus, recipes, workshops they can attend. So getting the word out on that can really make a big difference on a local level. So when you're working with programs on this local level, I would say you don't have to start from scratch. There are lots of great tools out there already to support your work engaging early childhood educators in healthy practices. So on your screen here, you'll see a couple of really good examples on physical activity. These are new materials from the California Department of Public Health in English and in Spanish, and also painting preschool playgrounds for movement. These are the kinds of things that will really help out a program if they're trying to actually increase the physical activity. Incidentally, there's new evidence that the recommended 60 minutes of physical activity that children have, or that should have every day, that this children who have that have improved cognitive function. So these resources on physical activity are particularly valuable at this time, and also just provide really solid ideas for what childcare providers can do to increase the physical activity and why they should in their programs. It's actually a pretty easy sell because most childcare providers know a lot about kids, and they know that children who are playing physically are happier and do have a good time while they're at childcare. So in conclusion, more than 60% of children ages birth to 5 years live in households where both parents or a single parent are in the labor force. So if you're looking to make place-based change, this is where a lot of children are. When families have access to reliable, high-quality childcare, they can go about their business, attending school or going to work or looking for work, knowing that their child is in a safe place where they can learn and grow. In turn, a well-functioning early childhood system benefits families, local communities, and the economy. So good for all of our society. ECE environments are just ideal for place-based changes supported by systems and policies that help children to grow at a healthy rate. So before we take questions, we would really like to thank our advisory committee for their work on this project. Over the course of the last year, many professionals in the ECE community have helped to inform this guidebook, and here are their names. And there were more, I will say, who responded to our questions, our many, many questions over the last year. So we're very grateful for people who weighed into this for their contributions. And then there is just one last slide about accessing this recording. So the recording of the webinar will be on the YouTube channel of the California Child Care Health Program, and a direct link to the recording will be available after the webinar. So now we are ready to take questions. If you have any questions for us, there's a chat box that you can use to type in your questions on the bottom of your screen. There's like a little message bubble. So if you have a question, you can click on that, and we will provide an answer for you. Right, yeah. Okay, so once again, there will be a little bit of a wait for the guidebook. Unfortunately, it's not quite available, but it will be you will be able to find it on the website after the announcement is made. So it will be, it will happen shortly, but again, we're putting the finishing touches on it right now. I think we will give it, so far we're not seeing too many questions. Oh, okay, here's a question. Okay, so somebody has asked us, do you have a time frame for when the guidebook will be available? So we are in the last phases of the layout, and we'll have to give it another, we call it a proofread, a copy edit. At that point, after that, it will be available. If you are interested in taking a look at it and possibly to provide some feedback from the field, you will have the opportunity to do that. And if you would please send the email to Monet Parham-Lee. I think, and again, you could contact me or contact her directly to find out about that. Okay, there's another question. Oh, okay, this is actually from Monet. And she is adding this comment that CDPH has to give final approval, and this has its own timeline. So we'll have to be patient and realize that it is out there. But I would say in the meantime, you'll have my email address, and if you have any specific questions that I can answer for you based on the information provided in the webinar today, I'm happy to answer any questions to get you started. But since CDPH has its own timeline and we don't really have a direct answer on when it will be available. Okay, so this is the last opportunity for questions. If you happen to have one, please type it in now. I think we'll give it just one more minute and then we will conclude the webinar and sign off. Oh, okay. Oh, one last thing to mention that tomorrow you will receive an email, a follow-up email from this webinar, and that will have a survey in it. The survey is just, I think it's 5 or 6 questions with a link or an open field for additional comments. If you would kindly fill out the survey, then that gives us an idea of how the webinar went for you on the other end, and also if you have any other ideas for future topics that you would like to have covered on this theme. So when you get that, if you would take a minute to kindly respond. Okay, well, thank you very much for joining us today. It's been a pleasure, and please let's leave the communication open. If you do have any questions or comments, feel free to email or phone, and we'd be happy to talk to you. So thanks very much, and have a good day.